When I was a child, I watched my grandmother press a handkerchief to her face in a photo album, laughing at a younger version of herself. She used to say, "We change little by little, and that's how we learn to love ourselves again." Those small, quiet alterations were natural. Haircuts, new glasses, a different dress, the ways we negotiate identity with the world. But what happens when the negotiation becomes surgical? When longing, loss, hope, and pain are measured in millimeters? There's a symptom of modern life where the body becomes a project and beauty is no longer just found, but engineered. For many, plastic surgery is the answer to a private ache, a scar that won't fade, a nose that feels wrong, breasts that don't match the rest of the person. I've met people who carried decades of self consciousness and walked out of clinics with new posture and a reclaimed confidence. One woman told me she could finally meet her reflection without rehearsing excuses. Another man said his procedure allowed him to step into a career he had shied away from. These stories are intimate, fragile. They aren't about vanity so much as a desire for coherence between inside and out. To understand this choice, imagine living in a world that constantly defines you. From childhood, you learn what features are applauded, what bodies are desirable, and which traits will cost you social currency. For some, surgery is agency, a deliberate, sometimes desperate rewriting of the script written by genetics, trauma, or culture. For others, it's a slippery slope into a market that profits on dissatisfaction.
Let's be blunt. The global plastic surgery industry is a booming economy that feeds on aspiration and insecurity. Billions of dollars flow through marketing channels promising transformation, happiness, instant validation. Before and after photos don't just sell procedures, they sell the idea that dissatisfaction is a solvable flaw, purchasable at the right clinic. Influencers and celebrities normalize cosmetic enhancement. Filters and face tuning apps train an entire generation to prefer curated, perfected images. When everyone's face is a potential project, where does authenticity go? And then there's the darker commerce, unregulated clinics, bargain deals, and medical tourism that takes desperate people across borders to cut costs, sometimes with lethal results. In seeking better looks, some people risk their health on makeshift procedures in back rooms or in countries where oversight is weak. The economics create an ecosystem where risk is outsourced to those least able to shoulder it. If beauty becomes a commodity, the ethics are complicated. Are surgeons healers, artisans, or merchants? This is not only about vanity, it's about power. Who gets to define the standards, who profits, and who pays the price? There's a cultural feedback loop. Media shapes desire, surgeons supply solutions, and society adjusts its ideals around those updated images. Over time, what was once an exception becomes an expectation. Teenagers compare themselves to surgically altered celebrities and to faces doctored by pixels. Clinics then offer taste-tailored packages and payment plans. It's seductive. It's also a social force that transforms not just bodies, but norms. To move beyond opinion, let's look at facts, risks, and the medical realities behind the rhetoric. Plastic surgery, as a medical discipline, spans a spectrum: reconstructive work that restores form and function after trauma, disease, or congenital conditions, and cosmetic procedures intended primarily to alter appearance. The training required for a qualified plastic surgeon is extensive: years of medical school, residencies, specialized fellowships, certifications, and continuing education. Yet credentialing varies widely by country, and titles can be confusing. A doctor who calls themselves a cosmetic surgeon may not have board certification in plastic surgery. That distinction matters for outcomes. Every surgical procedure carries risk: anesthesia complications, infection, scarring, nerve damage, and in rare cases, death. For cosmetic operations, these risks are weighed against the benefits of improved self-image or functional gains. But the statistical margins can be deceptively small. Even a low complication rate becomes significant when millions of procedures are performed annually. Consider rhinoplasty, the reshaping of the nose. It is one of the most common cosmetic surgeries and one of the most technically demanding. Tiny changes in cartilage and bone produce large perceptual differences. Patients can end up with breathing problems, persistent swelling, or asymmetry requiring revision procedures. Liposuction, too, carries serious risks: fluid imbalances, fat embolism, and contour irregularities. Breast augmentation has been linked in some cases to rare conditions like anaplastic, large cell lymphoma associated with certain implant textures, prompting regulatory scrutiny and recalls in multiple countries. An informed decision requires clear, evidence-based consent. That means patients should hear about realistic outcomes, recovery timelines, alternative options, and the potential need for revision. Preoperative psychological screening can help detect body dysmorphic disorder, BDD, a condition in which patients perceive flaws that are minimal or non-existent. Surgery rarely resolves BDD and can worsen distress when outcomes don't match unreal expectations. The industry is also shaped by technology and innovation. Imaging software and 3D modeling allow surgeons and patients to preview expected results. Minimally invasive techniques reduce downtime. Regenerative medicine and fat grafting push the boundaries of what's possible. But technology is a double-edged sword. It can both refine care and further individualize aesthetic standards, making the perfect look an ever-moving target.
So, where does this leave someone sitting across from a surgeon, heart pounding, ready to sign consent papers? It starts with introspection. Ask, why am I doing this? What do I expect? How will my life change if the procedure goes perfectly? And how will I cope if it doesn't? Consult multiple specialists, verify credentials, ask for before and after photos of real patients with similar attributes. Check facility accreditation and infection control standards. Understand recovery, pain, time off work, possible emotional ups and downs. Make a plan for realistic outcomes and, where possible, non-surgical alternatives. I need to be honest. Plastic surgery can be transformative in benign and profound ways. Reconstructive surgery can restore function, dignity, and identity after injury, cancer, or congenital anomalies. For transgender patients, gender-affirming surgery can be life-saving, reducing dysphoria, and improving mental health outcomes. Cosmetic procedures can repair the wounds of trauma, a child's scar removed, a cleft palate closed, and they can give people the confidence to step into lives they had only imagined. But surgery can also be an escalation. The more one modifies, the less satisfied they may become, chasing an ideal that keeps retreating. The cultural pressures are relentless. Aging faces are framed as failures to be corrected. Natural variation is treated as a flaw. Social media and targeted advertising intensify this. We must ask whether cultural change is needed alongside clinical safety. Can we create a culture that values diversity of bodies and faces and teaches resilience against commercialized ideals? There is policy work to be done. Stronger regulation of clinics and credentialing, transparent reporting of complications, and restrictions on predatory marketing to minors would help. Education campaigns can teach media literacy and healthy body image from adolescence onward. Insurance policies could recognize the mental health dimensions of certain procedures and fund supportive therapies where appropriate. International cooperation can limit dangerous medical tourism by holding clinics accountable and publishing safety data.
But perhaps the most human question is this: how do we balance the undeniable agency of individuals to change their bodies with the social forces that shape their desires? We must respect personal autonomy while acknowledging the context, the filters, the ads, the industries that push people toward the scalpel. Surgeons, regulators, media platforms, and the public all share responsibility. I've spoken with surgeons who describe their work as craft, precise, respectful, life-saving. I've met patients whose surgeries were small miracles. I've also seen shadows, regret, exploitation, and avoidable harm. The truth sits between those extremes.
If you are watching this and thinking about surgery, treat yourself with the same compassion you hope the surgeon will show. Take time, get second opinions, seek mental health evaluation if you feel that your distress is more than dissatisfaction. Look beyond the filtered image to who you are and why you want to change. If your goal is to align your inner life with your outward appearance, surgery can be a tool. If your goal is to chase a moving target defined by commercials and algorithms, pause. Plastic surgery is a mirror held up to our times, to our values, our anxieties, our ingenuity. It reveals a species that both heals and markets, that seeks control over nature while inventing new standards to satisfy. It asks us to decide what we will accept about ourselves and what we will alter. In that choice lie ethics, economics, medicine, and something deeply personal, the longing to belong in our own skin.
In the end, changing a face or a body is not only a technical act, it's a cultural act and an intimate promise. If we proceed with care, with honesty, rigorous standards, and empathy, we can preserve the dignity of those seeking change while protecting the vulnerable from harm. If we fail, we risk making the next generation believe that the self is only as good as the last upgrade.